Good morning, good afternoon, good evening, everyone. Hello, and welcome to our third webinar of our Practitioner Perspective series. I'm your host, Rahul Goyal, co-founder at UB Health. UB Health, born out of personal experiences of founders, has an integrated platform to help people in all stages of physical and emotional wellness that enable personalized care and compassion. Joining me today on our show is Dr. Lawrence Choy, and he's going to share his perspectives on how stress at work affects your employees' health. Dr. Choi specializes in treating adult ADHD, improving cognitive and emotional abilities, and enhancing overall performance and executive functioning. Dr. Choi combines his clinical expertise in brain plasticity, psychotherapy, and wellness approaches to develop personalized, effective, cutting edge treatments for his patients. His innovative approach is effective in helping patients overcome lifelong challenges, develop resilience, and perform better in school, work, and relationships, ultimately achieving a greater sense of meaning and purpose in life. Dr. Choi, welcome again. Um, so, to start off, what do you think is the relationship between stress and performance? How can stress affect our performance?
Well, I want to say, Rahul, thank you for the wonderful introduction, and I'm really happy to be here. So, we're talking about stress, which is something that I have a great deal of passion in helping other people learn about and how to manage. Since I work in Silicon Valley, a lot of people here are pushed to the extremes in working. So many people do deal with a lot of stress and burnout. So I do treat a lot of patients that come into my clinic with um, learning, helping them to overcome stress, right? So we're going to be talking about how stress at work affects employees, right? So it's important to define what stress is. When we think about stress, I'm so stressed out. We tend to refer to this negative, unpleasant feeling that does impair our ability to cope, right? So how I like to think about stress, yeah, and thanks for helping me control the slides. So what is stress? So the next slide, Rahul. Yes, so for me, I like to explain things based on science. I trust the science, and knowing how to work with the science does allow us to effectively manage our stress. So stress, what it is when our body is in a sympathetic state. It's in our fight, flight, and freeze state. And in this state, our blood pressure is up, our heart rate's increased, we sweat. It's used when we need to react quickly to any type of situation. And this helps us survive, yet our body, we're not meant to be in a stress state for long periods of time. So when that happens, our body does go through this cortisol dysregulation. So cortisol is a stress hormone. And we'll talk more about cortisol later. So the key points here is that when we think about stress, think about our body being in this fight, flight, freeze state. And that as that's happening, cortisol is being released, and long-term it can become dysregulated. Right. So with stress, what's the relationship between stress and performance? So stress does have a negative connotation, right? So people think it's bad stress, right? But stress is not bad or good, right? Stress is a part of life. So what's important is how we manage stress. Right? So let's move to the next slide. All right. So this is an inverted U curve. It's the Yorkiesdson Law. And it informs us how our performance is dependent on our stress level. So performance, it could be physical performance, cognitive performance, mental performance. right? So just how we perform. So if we're thinking about an employee, how the employee is able to function effectively to meet their expectations, right? So I guess I'm unable to put my cursor on the slide, but on the horizontal axis, when stress is low, right, we are in a relaxed state, right? And on the other end of the I guess axis, where we have high stress, right? Our performance is also low. So there is an optimal stress level where our performance is, right, at its peak. So that does require us to have moderate levels of stress. So that's why when we're not really stressed, we tend to be checked out, bored, disengaged. And as stress levels increase, then we become engaged, challenged, right? So for me, I guess as I'm giving this webinar, putting the slide deck together, um, and guess when I completed the slide deck. Oh,
Few minutes before, I'm assuming.
yes, absolutely. So it's not that I'm not motivated. It's just that I do need stress. Yes, I depend on stress to motivate me. So
So
knowing
not
that,
all stress is bad. So not
no,
all
no,
stress.
yes, yes, I actually, it was necessary for me to like create this slide deck. So as the stress levels increase, as the time for this webinar came, then it got me to become engaged and challenged to create and finish the slide deck. But had I waited too late to do this, then the stress, I would get past the optimal point. So I would be in a distress state. I would, as I continue, the stress continues to increase. And if I didn't have this like slide deck put together, I would have been panicking. Right? I would have been breaking down. So yeah, so that's when stress can get to the harmful sort of like toxic area. So it's important to know how to navigate the stress. So since I'm very well aware of how my body functions on the stress curve, I can predict like how much time I can have to actually put things together. So
So basically, Dr. Lawrence, right? Looking at this, one could figure out as when they are going from an optimal point to perhaps, maybe where it could start to affect their brain, body, and function. Is that the way to represent this? Is this is like these are the symptoms of when you're getting into the more of a sort of like a danger zone of a stress?
yeah, yes, great question. So this can happen moment to moment. So it's very dynamic. And at the same time, it also uh, can be seen through, I guess, a more long-term state, like how many hours, how many days that you've been in the stress state. Yeah, so then that's more of the chronic stress versus the acute stress.
Okay. So is there, like, in that sense, what kind of effects, like how does it affect, in our body, our mind, internally?
Hey, great question. It will be answered in the upcoming slides. So let's move on to the next one. All right, so yeah, there you go, right? How stress affects health. So what happens to our brain, body, and mind, right? So if you can click the next slide. All right, so I have two diagrams here. So this is from an image in the journal article from the Arstein lab in 2008. So on the left side, we have an image of the brain when it's calm. Right? So in the calm state, cortisol levels are pretty much at baseline. And we're not in that sympathetic fight, flight, or freeze state. We tend to be more in this parasympathetic state. So when we're in a calm state, the part of the brain that's colored in that bluish green, that's the prefrontal cortex. So the prefrontal cortex, or the PFC, it is the last part of our brain to develop. And this part of the brain helps us thrive in life, right? It's not to survive, but it helps us thrive because its functions are to help us with regulating our attention. That's the top-down guidance of attention and thought. It helps us with inhibition of inappropriate actions. That's impulse control. Um, it's the it's where our reality testing, right, takes place. So what reality testing is our subjective perception matches objective reality. So an example of that is, let's say that if I'm scared and I see a shadow somewhere, my mind might come up with a perception, impression of what that shadow could be. Is it, I guess if I'm walking like on a trail, is that a snake? So my mind can start convincing myself that yes, that is a snake, and it could have just been a branch, right? So and it does give us that ability for error monitoring. So we're able to detect when our mind's making any type of judgment error. So it does improve our decision making, having our prefrontal cortex functioning properly. And the PFC also helps us regulate emotions. So emotions such as fear, anger, right? So when we're calm, we're effectively able to navigate these. Yet when we become stressed, so on the right side, what happens is the amygdala and takes over. So the amygdala, it's the emotional command center, and it tends to be negatively biased, right? So it gets activated when we are distressed. And when that happens, guess what happens to the prefrontal cortex, the PFC? It,
It stops regulating.
it goes offline, right? So an analogy I would use, since we all use our smartphones now and we depend on many of our apps, is like this app gets inaccessible. Like
Right.
we don't have that app anymore. So without the PFC, our ability to regulate emotions, have impulse control, decision-making capacity, it becomes limited, right? And the amygdala will now activate our lower level parts of our brain. And these are our primitive areas. So
Right.
we will do things out of reflex, we will react. So this is, I mean, it's for survival, right? If we're driving in traffic and some car cuts us off, like we have to react quickly, right? Either slam on the brakes or swerve away. So there's no time to really think. Um, Yet, if we're, I guess, working at work, and if we get an email that might agitate us, and if we impulsively write something and send it, right, send, oh, that can, right, have its consequences. So we want to be able to regulate when we're stressed. Right?
That makes a lot of sense.
All right. So, one additional point about this. So if we look closer at, I guess, the processes happening in the stress brain, so, so emotional habits. So I guess for fear, what our habits tend to, if we're stressed, our habits could be, I guess, avoiding, running. I guess when I say running, I'm meant escaping.
Right.
Right?
Right.
So
Right.
escapism behaviors. So when people are stressed, they might escape to things that might be unhealthy for them, like substance use, right? And or just binge watching Netflix, which might be fun, but then it's unproductive, right? So and the bottom up attention. So what that is that our feelings, our emotions will influence how we perceive events, right? So if we're stressed, we since we will start feeling feelings of frustration. So that will cause us to perceive what we're frustrated at as like the enemy. So that can really create a negative situation in the workplace.
So those are like, so like, I mean, in essence, what you're saying is could be a possible ways to address negative effects of stress.
Yes.
But in essence, right, like, so, as individuals, we all go through stress, and sometimes you're able to manage it, sometimes you are not able to uh, manage a certain level of stress, maybe because we are in this environment where you have a people are fairly occupied, and you have a lot of work, and and truly, like, a lot of families or parents or people, right, who might be doing multiple jobs and so forth, right? And so, like, they would even if not wanted, they might come across, like, that top end of the curve where they start to slide on the right hand side.
Yes.
And so how can they, are there strategies or things, like, beyond even what you've shared, that they can use to address the negative aspects of stress?
All right. Yeah, it's a great question. Like how do people navigate the stress, right? So if you can go back a couple of slides to that Yerkes-Dodson, or is it one or? Yes. All right. So I want to be able to connect um, the slice of the brain to this one. So at the optimal point at the top of the curve, that's when the prefrontal cortex is optimally engaged. So that's when we perform our best. As stress levels increase and we start to slide down that curve, in that distress, fight, flight, freeze zone, that's when the prefrontal cortex is offline. So that is when we are in this reactive state, and most of our behaviors will be more reactive rather than proactive. So, and our reality testing is distorted in this area. All right. So, and it is if we hang out in that distress state too much, that is where clinical, like, mental health issues will arise, like depression, anxiety, and I mean, and as we know, one of the end states of depression is suicide. So if people are in that prolonged state of stress, that there is a risk of that.
So so it is very important for us to watch our stress levels, because, of course, right, we don't want to get down that pathway.
Exactly. Yes, because being in that pathway, it is toxic, right? So looking at this this new slide, this is how stress affects our body as well, right? So um, on the left side of the slide, this is a normal stress response. So what the normal stress response is physical stress, mental stress, oxidative stress, right, does impact the brain. So the HPA axis, that's the hypothalamus pituitary adrenal gland. So that is the pathway that activates our stress response. So the hypothalamus is part of the brain. It activates the pituitary gland to release a hormone that will travel right to our adrenal glands, which sit on top of our kidneys, to release cortisol, right? So cortisol tends to have a negative rap, right? Cortisol, its function, right, for in the normal stress response is to help us, right, block inflammation, right? So inflammation is when our immune cells does create an inflammatory response that can damage things around it, like cells and tissues. So under normal stress, it does take care of the inflammation. However, as we're in a chronic stress state, what happens is that the immune cells, they get smart, and um, they will become desensitized, right, to the cortisol. So rather than inactivating the immune cells, right, they become more aggressive, and they will exact their inflammatory response on the body and the brain. So it feeds back and adds more stress to the brain.
Mhm.
Right? So what our brain and body will do now is activate our autonomic system. So that's the SNS and PNS, right? So it's a different pathway to try to manage inflammation. So as this continues to happen, and if we're still in a prolonged state of stress, cortisol release will continue to be elevated, and we'll move to this chronic stress and cortisol resistant state. So what happens there is that the adrenal glands eventually become fatigued, right? And they're unable to release cortisol, right? So now cortisol levels are low, right? And the autonomic nervous system will also, right, get out of whack. So autonomic nervous system controls functions like our heart rate, breathing, sleep, right, digestion. So people under chronic stress, they do develop these medical issues, right? Sleep becomes problematic, right? Appetite, and and people do get at risk of developing, say, like hypertension, diabetes, heart disease, etc. Right? And what's important about the brain is that, right, you can see it says brain damage. So all that stress is damaging the brain. Right?
Oh my God.
Yeah,
It
I,
is
I'm making it really scary. Huh?
it's a scary picture in some ways. Um, but I mean, I think there is certain, like, you always think about stress as an external aspect, but this gives a very clear picture of how it actually functions in your body and what actually happens in your body. So I'm must say I'm really impressed.
Yes, yeah, like that stress, it is physical, right? So, and yeah, I think about it from a physical view. So, if we get to that, this sort of this end state, I guess when we injure our body, let's say that if we run a little too hard, we might strain a muscle. But if we take care of our body and recover and let it recover, rest, right? We will heal from that. But if we keep pushing ourselves, right,
Right.
and if we tear, right, a tendon or we break a bone, now that's going to take a longer time to heal, right?
Yeah,
So that is the same thing with stress. If we're in that chronic stress state and we keep pushing ourselves, like we will damage our brain and nervous system, or right, I mean, it's going to take a really long time for it to heal, and
hmm,
sometimes there could be potential irreversible damage. So we want to stay right more in the, I guess, that green and yellow zone rather than getting to the red zone.
makes sense. Makes sense. So, what do you recommend as some of the strategies, Dr. Lawrence, in the combating the stress?
Yeah, let's click on the next slide. Um,
Sorry.
okay, so yeah, strategies to navigate stress. So I have this bathtub model of stress, right? So what this bathtub model is, so imagine our body is the bathtub, right? And stress is the water that pours in, right? So in life, right, we can never fully turn off the water, right?
Mhm.
So we can adjust, right, the rate that the water is coming in, right? But we can't turn it off. So and in life, right, what happens is that sometimes the water levels rises faster than we can drain it, right? And when it reaches the top, it's just going to overflow and damage whatever is around it. So um, so what's the most effective way of draining the water? It's
Open the plug.
which in life there's no plug. Well, I guess if you put a plug there, it's actually going to cause more water to flow. So it's aerobic exercise. Yeah, so the slide that you put, yeah, so going back to the stress performance curve, when we flip it upside down, like what we get is the bathtub, right?
Mhm.
Stress is the water that comes in, right? So aerobic exercise will drain the stress. And the science behind that is because when we're exercising, we're activating our sympathetic nervous system. Like,
Right. So it's like the exercise is a plug in this case for draining that built up pressure or whatever you want to call it, right? The stress out of your system.
Well, I guess with the plug, we want to remove the plug, right? Because we want the water to drain out, or
Yeah,
yes. So I guess the exercise, yes, it's the plumber, right? It's the person who comes in and helps get rid of all that water as quickly as we can, because we want to keep our water levels like low.
sure, sure.
Yeah. And yeah, so aerobic exercise, physical activity, like that is key, right, for navigating stress. So usually when people are stressed out, like what's the first thing that they stop doing? It's exercise,
They
right?
stop exercising because they're too tired or they feel
Yeah,
fatigued. Right?
tired, or there's no time. Like I don't have time to exercise. Like
Yeah,
I've got work to do. I have to finish this deadline.
yeah. I mean, I can share like my own personal example in this. Like, there are days when you have a lot of work back to back to back, and you have still more work towards your later part of the day, and often at times, like at times earlier I used to just get bogged down by the end of the day, but then I started breaking up my day, and I would use that time to maybe go and for a walk or do an exercise, do a session, and then I'll just feel like this sort of like renewed energy coming
Yes,
back in. So I think now I can relate the clinical point of view in all.
yes. And what you're doing when you're taking time, right, to be present and mindful and pause, right, just pausing, uh, that helps us get out of that sympathetic state into the parasympathetic state. So that is slowing down the rate that the water is coming in.
Hmm.
So so sleep is also very important, right? So that slows down the rate that the water is coming in. So with this bathtub model, it's either how do we drain the water as quick as we can and effectively, or how do we slow down the water?
Around the water.
Yeah. Yeah. So back in, I guess, college and med school, before I knew about this model, like when there were exams, I would get so stressed out that I stopped exercising. I crammed, I pulled all-nighters. I didn't sleep. So I didn't know how like how vicious of a cycle I was getting myself into. Like I wish I had known this model back then.
Yeah.
But now knowing this, it does allow me to navigate my own stress, because if my stress levels are high and my water levels overflowing, like my capacity to help patients that I'm treating is going to be impaired, right? I'm going to be unable to help manage their problems. So I have to be cognizant of how stress is affecting me. So,
Makes sense. So I think one of the aspects, Dr. Lawrence, that we wanted to cover, of course, we wanted to educate, our viewers about, like, how stress affects their life and how stress can affect their performance at work. But as employers of some of whom are watching, what advice would you give them in terms of how can they help their employees, knowing what they know now? What other things that they can, or programs that they can design that might help um, help them better manage stress at work?
yes, all right. Well, it's to know that, like, right, stress is a part of life, right? So, and it's a process. So, how employers can help their employees effectively navigate stress, right? And it's not at a single point in time, it's an ongoing process, right? So what employers can do is create a safe space to talk about stress and even talk about mental health,
Mhm.
right? So I like to talk about mental wellness, right? Right, rather than mental illness. So if we frame it as, right, a mental wellness, then people will be more willing to talk about it. So I guess focusing on the positive aspect of that. And so by creating a safe place to talk about stress, people will be more mindful, open about how things are affecting them. So what employers can do also is creating support for the employees to navigate stress. And if some employees are at the far end of that stress curve where they are burning out, I guess, creating some plans for how to help support employees through their burnout. And I mean, here in Silicon Valley, I, ha I haven't seen so many people like go on disability leave because of the stress that people have gone through during the pandemic. So, and their employers from these big tech companies have been very supportive. No questions asked, and they're able to go on disability leave for an extended period of time. And then these employees, they come back rejuvenated, refreshed.
Sorry, there is some issue on my side. My network just was blipping through a little bit, Dr. Lawrence.
I thought that was a signal that it's time to end.
No, certainly I would love to carry on this conversation, but I think we are on time for our session, and certainly it's been a very insightful session. Overall, I think it gives, I'm sure it gives our viewers a better picture on what is stress, how does it actually manifest, and how do you can deploy or use different strategies to better manage your stress. I think in the total context, I think a lot of this information isn't necessarily as easy as you have explained it to be. So very much appreciate you coming on and sharing with us your perspective on stress management and what it is, and then basically like even like for employers on what they can do in terms of different programs and education and things to really create a positive environment and a better work-life balance.
Okay. Yeah, thank you so much. And can you click on the slide one more time? Let's see. Yeah, so just wanted to thank the viewers for attending this with us today. Yeah, I love talking about, I guess, the neuroscience of this health, mental health. So I'm very grateful to have been invited here and to talk about this. So thank you so much.
Thank you, Dr. Lawrence.